Hey guys, my name is Dr. Pete Walimire. I'm here to talk about ankle sprains today. So this is one of the most common injuries that everyday Americans face. Happens mostly during athletics like basketball and things like that. But what is a sprain? A sprain is where your ligament tears. It tears specifically in the ankle from this bone called the fibula to your talus, and that happens when the ankle moves under. So it's called an inversion ankle sprain. You can tear one of two ligaments or both. The anterior talofibular ligament is the most commonly torn, runs across the front, and the calcaneofibular ligament, second most commonly torn, runs down the bottom to the heel. So what do you do for it? I suggest rest, ice, compression, elevation. We call that RICE therapy. If it's not getting better after a week, go see your doctor. Okay, so we've already done a video on low ankle sprains. This is the high ankle sprain. What is a high ankle sprain? It is a sprain of the ligament that attaches the two leg bones together. And this most commonly occurs when the leg is held still or the foot is flat on the floor and the foot gets externally rotated or the leg internally rotates. So what that does, you can see this bone's kind of square, and it's going to push against this bone called the fibula and tear them apart. When that happens, it's usually a surgical problem. You need to see your doctor right away.